Audio. Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle.
A policy is a course of action. It often takes the form of general statement regarding objectives, guidelines, processes, and expectation to be met. Based on the philosophy, the national policy on older people recognizes that they, as citizens with diverse backgrounds and experiences, have the right to a secure, enjoyable, and respected life while also contributing to the nation's growth. So, who's the founder? In 1946, the Department of Social Welfare was established. The Malaysian Social Welfare Department is responsible for the context of the national policy for the elderly, which is adopted under the Women, Family and Community Development Ministry. What do they do? This organization's mission is to foster a loving and harmonious community. Meanwhile, the mission is to work toward a socially harmonious society, and the motto is blessing of good deeds. The department's priority group including children, people with disabilities, and the elderly, who are the most significant. Why does national policy for elderly is important? This is because, based on the data and information stated in Malaysian Healthy Aging Society, Malaysia has increased the number of elderly communities, which up to 7.2% in 2020. Meanwhile, it was 6.7% in 2019. The number of elderlies expected and projected to be 15% in 2030. So, Malaysia needs to be prepared of the upcoming aging issue in our country by following the national policy for the elderly. The policy stated was the term older person refers to people who are 60 years old or older. This term is consistent with the Vienna World Assembly on Aging in 1982. Policy statement is as follows: to ensure the social status, dignity, and well-being of older person as members of family, society, and nation by enabling them to optimize their self-potential, have access to all opportunities, and have provision for care and protection. Let's move forward to the policy problem. As we know, every policy has its own problems in terms of executing the policy. First is shortage of skilled caregivers. Why? This is because our country is lacking caregivers training institution or university that teaches and provides caregiving skills. It is because people in our country are brainwashed that caregiving is an easy work and doesn't need a training institution. Besides that, Malaysia also facing shortage of affordable care. This is because a high cost of expenditure. In order to take care an older person, it took so much money such as medication and healthcare. For example, to buy elderly-friendly stuff such as adjustable bed, wheelchair, and scooter. Other than that, our nation is also having a problem on the shortage of elderly-friendly housing. In the meantime, our country currently having only 13 homes for the elderly, which is actually not enough for the amount of older people in our country. For instance, there is no elderly housing in Sabah, but only one daycare home which located in Sandakan. This has resulted on the problem of transportation and environment development since they have to go to new places and meet new people every day. There are also other problems such as lack facilities and lack of community care. Now, let's jump into the objectives and goals of national policy for the elderly. Every policy has its own objectives as a guideline to achieve the goal that had been set. So, these are some of the objectives stated in the national policy for the elderly. Firstly, to keep them involved and productive in the country's growth. Secondly, to instill in the family, culture and country sense of integrity and respect for the elderly. Thirdly, encouraging the development of facilities to ensure the care and safety of the elderly in order to improve their quality of life. Last but not least, to raise awareness about the aging problem and build supportive communities. There's a lot more objectives that's stated in the policy making. However, for the goals of this policy is almost the same with the objectives, but slightly different, which is the national policy on older persons is the government's commitment to help older people become self-sufficient, dignified, and valued by maximizing their self-potential through a stable, optimistic, involved, prosperous, and compassionate aging to live a happy life.
Actors in policy. The actors that involve in making of national policy for the elderly is the Prime Minister. The Prime Minister is one of the executives for the policy to implement public policy and supervise and manage ministries are the main responsibility of the executive. The Parliament is legislature in policy making. The Parliament have direct constitutional authority to formulate and to initiate policies. Other than that, government agencies such as Ministry of Women, Family, Community Development are the chairperson, also the technical committee for national policy for the elderly and the National Advisory and Consultative Council. Ministry of Health also established facilities such as health centers for the elderly people to have care and protection for themselves. Next, political parties. The political parties are a group that come together with the intention of gaining control of the machinery of government. Next is interest group, are a group of individuals who share common belief and interests relating to their demands. Strategy of the policy. First, respect and dignity. To enable older persons to live with respect and self-worth, safe and free from exploitation and abuse. To ensure older persons are given fair and equal treatment irrespective of age, ethnicity, religion, disability, or the ability to contribute. To enable older persons to optimize their potential. To enable older persons to have access to educational, cultural, spiritual, and recreational resource in society. The second strategy is self-reliance, to ensure that older persons are able to fulfill their basic needs through income source, family and societal support, and self-effort. To enable older persons to have access to opportunities to continue to serve and contribute. To enable older persons to enjoy an environment that is safe and conducive in accordance to their needs and changing capacities. To enable older persons to make early preparation to plan their continuous contributions towards national development based on their expertise and capability. The third strategy is participation, to enable older persons to play a role in society and be actively involved in the formulation and implementation of policies relating to their well-being and to pass on their knowledge and skills to younger generations, to provide opportunities to older persons to voluntarily contribute to society in accordance with their abilities and interests, to encourage older persons to establish associations and organizations that conduct activities for their own well-being. Fourth, third and last strategy, care and protection, to establish facilities for care and protection within the family and the society in line with the local socio-cultural system, to enable older persons to have access to healthcare, to enable them to maintain or restore their optimal physical, mental, and emotional health, to enable older persons to have access to service of institutions that provide care, protection, and societal and mental stimulation in a safe and comfortable environment, to establish a comprehensive social security system to ensure the finance and security and welfare of older persons.
Next is the evaluation of the effectiveness in this national policy for the elderly. So the first thing that in this policy is that Malaysia is the earliest country in the Asia-Pacific region to have the policy for older person, which means Malaysia is the first country who has implemented this policy. And this shows that Malaysia is concerned about the older person that lives in Malaysia. It is unique because in the Asia Pacific, Malaysia is the first country who has implemented this policy, and after Malaysia has implemented this policy, then other countries in the Asia Pacific region also started to implement this policy in their country. The next trend in this policy is this policy also gets a lot of support from the private sectors and also the NGOs. Not only the government who is managing in this policy, but there's also a lot of agencies, private sectors, NGOs, and also individuals who are also managing this policy. They give a lot of contributions, such as the NGO built home and also shelter for the elderly, and they give contribution in terms of monetary. This is to ensure that the national policy for the elderly in Malaysia achieve their objective. The next trend in this policy is the Technical Committee of the National Policy for Older Person was formed. It was formed in July 1996. This policy was formed by the government to ensure that the older person also can participate in the country development in terms of publicity, education, health, and also religion. This policy was also formed is to ensure that the older person will not felt left over. As for the weaknesses in this policy is, the first weakness in this policy is the population of the elder people in Malaysia is keep increasing. When the population of the elder people in Malaysia is keep increasing, it will lead into the increasing of ill health and also disease. This will affect the policy objective, which is to make the elder people to participate and also to contribute in the country development. Next weaknesses in this policy is most of the older people did not receive the social security scheme, such as pension scheme. Only those who are working in formal sector will receive it, and those who are not working in formal sector will not receive it. This will affect the income of the older people, and they could not afford their needs because they have no income. The weaknesses in this policy is also lack of infrastructure for elder people in Malaysia. The elder people need infrastructure that is suitable for them because as they're getting older, they need support because they are not that strong enough as usual. For the opportunities in this policy is a lot of agencies are also contributing in this policy. They contribute a lot, and this will help the government to fulfill the needs of the elder people. There's also a lot of society who is involved in this policy. This is to ensure that the relationship between the society and the elder people remains strong. For the threats in this policy is the increasing number of mental and physical health by the elder people. This will lead into the shortage of healthcare services in the hospital, so the government need to make sure that the healthcare services in the hospital are enough for the elder people. And this will also affect the financial of the government. Next threats in this policy is lack of awareness from the society about this policy. When there's lack of awareness from the society about this policy will not be succeed. This is because the society are not giving support for this policy. In this policy is the government should always prepare the steps to provide good services for the elderly, such as the government should have a main financial income for this policy. So the government can use the money to provide infrastructure for the elderly. When the government have main financial income for the elderly, there will not be a problem to provide services and infrastructure for the elderly in the country. This government should spread more knowledge about this policy to the people. Government can spread about this policy through ads, social media, newspaper, and also television. This is to ensure that the people will give more support towards this policy, and it is easier for the government to achieve the policy objective when it gets support from the people. The third recommendation for this policy is the government can improve the criterion for admission to the home of elderly. This is because one of the process of admission to the homes of older people is the older people should not suffer from any contagious disease. Government should improve this criteria because when any older people that suffer from contagious disease and lives without any relatives or family, they will not have anyone to look over them. Government can build shelter or home that is specialized for this kind of cases. The last recommendation in this policy is the government should build more home care for the elder person. This is because there is only a few homes for the older person in Malaysia. In Sabah, there is only one home care which is in Sandakan. Government should build more home care for the older person.
Summarize up, the policies are meant to ensure a better life for the community in our country, but the most important community in this discussion is the elderly. We believe that Malaysia is already on the right track to face the challenges of population aging, thanks to the policies such as National Social Policy, National Welfare Policy, National Policy for the Elderly, and National Plan of Action for Older Persons. To ensure the efficacy, the interpretation of such policies into acts must be closely monitored through the framework for cooperation between various agencies and NGOs is formulated at the highest level. It is critical to ensure that all directives are passed down to the grassroots level for implementation. So, we need to spread the awareness of aging matter in our country, especially to the young generation, to ensure that they aware and get ready of any circumstance of elderly issues so that the development of our country is not affected by the unmanaged population of older people. An elderly once said, aging is not lost youth, but a new stage of opportunity and strength. By Betty Friedan.